Good evening, everyone. I'm going to start I'm going to share my screen, and so you guys can see the presentation. And then I'll introduce myself. I'm Ethan Schwer. I'm a licensed psychologist. I'm also a nationally certified school psychologist. I've been working at Groves Academy since 2015. I've worked in various school districts. I've worked, have a lot of training in neuropsychology. I did my internship, my APA accredited internship in Illinois. Have worked in Illinois, Wisconsin, Minnesota, and have had a lot of different experiences throughout my career. And I serve right now as the director of diagnostics within our learning center. And so tonight's topic is talking about the nature of anxiety in better management. As we go through, please ask those questions through that function that Joanna recommended, and then we'll see if we can get to them. I will also include my email address at the end of this, so if you have questions later on that you think of, you can always feel free to reach out and ask me. And email is generally a pretty good way to get a hold of me. So I'm going to start off the presentation with a little video. I got a little video from YouTube, and you'll see that when we look at this, some of this might seem a little humorous, but some of this we might actually even relate to. Like as I was watching this video, I was like, yeah, I do that, and those are some of those moments that I have even with anxiety, and we'll probably be able to relate to a few of these things. So let me play this short video clip, and then we'll kind of get into the presentation. All right, that last one, that's definitely me. Did you turn off the stove? Did you shut the refrigerator? Like if we ever go on a big trip, like I'm double checking, triple checking things. But we all have these levels of or moments of anxiety in our life, and sometimes it's more pronounced than others, and it's brought about by different situations and different things that occur. And so, how do we manage that? How do we address that? And where is this anxiety even coming from? And even understanding where this is coming from is going to be very helpful as we start to looking at how to address it. So here's some of the overviews, a little bit of my overview and goals of this presentation is I do want to give an overview of that brain structure and processes that is interrelated to that anxiety. And that helps us know kind of where this comes from. It also tells us how do we approach it, okay? And so we're going to talk about that anatomy of stress and anxiety. What is stress? What is anxiety? Are they the same? Are they different? We'll talk about different types of anxiety. I will bring this out from a clinical lens. So I will talk about what is a generalized anxiety presentation, what is a social anxiety presentation, and talk about different approaches we can use for those different types of anxiety. And when we talk about anxiety, there's definitely that clinical presentation where you have a disorder, but there's that other anxiety that, when we talk about any type of feeling, there's a broad spectrum, and it might be not as severe where it's a disorder, but we still might have plenty of anxiety where it affects our daily life in some facet, and how can we manage that? And so I'm going to talk about some of the ways to manage that. And really, the ways that I'm going to talk about managing this is going to be very much a holistic approach. I will talk a little bit about therapy and a little bit about medication, but I'm going to talk about a lot of things you can do on a day-to-day basis. Now, if you're even somewhat familiar with anxiety, a lot of this presentation is going to be, it's a lot of it's going to be a little bit of review, and you might learn a few things here and there, but it's really about what can we do on a daily basis to help with the self-care that's going to help manage anxiety. And it's also going to help with a lot of other things too, whether we are feeling depressive symptoms or other stress in our life. And then I'm also going to wrap in some COVID-19 considerations, and that has added into a lot of anxiety that we've had. And whether that's related to contracting the disease or actually one of the things that we've seen is especially during the peak points of COVID-19, there's been a lot more isolation and not being able to connect with others, and that has led to some anxiety as well. So we're going to talk about quite a bit within this. We're going to talk about those neurological and neurobiological underpinnings, and there will be some statistics with this and some things that some people really enjoy, some people don't. But bear through those pieces of this, and then we'll talk about how to address it. Okay. And then Joanna, I'm not seeing if from my screen, I'm not seeing when the questions are starting to pop in. So can you let me know when would be a good time to stop and maybe address some of those?
Yep, I will let you know.
Perfect. Okay. All right. And you'll see me looking off to the side a little bit because I haven't figured out how to have my notes pages along with the presentation through the Zoom conference. So the first thing that I'm going to show you is one of the models that's out there for anxiety. And so we're going to study this pretty extensively, and we'll break this apart. Just kidding. No, we're not. But what I wanted to show you, and we don't need to break this apart to a significant degree, but anxiety is a complex thing, and we don't understand it all yet. There are pieces to it that we know how to manage, we know how to address it, but there isn't this. But we don't have a complete, full understanding of all of it, and there is anxiety that people feel that we still don't know exactly how to fully remediate or fully fix, if you will. A lot of our practices have gained a lot of backing to it, and we are much better with addressing it than we ever have been before. But there's still a lot of work to be done, and it's because it's a very complex thing. Anxiety comes from a lot of different places. A lot of it is neurobiological. You're going to see one of the big things at the center point of this diagram is the amygdala, and we're going to talk about that within that brain function here in a little bit. But even within this, even as we get into this external threat, okay, that external threat can mean a lot of different things to a lot of different people. And it depends on some of those genes that are activated within a person. It might be dependent on how we perceive things. If we talk about snakes or spiders, personally for me, that's something that probably won't create a lot of angst. But unfortunately for my mother, who had a fear of spiders, and she had three, or not spiders, but snakes. She had three boys, and we played into that a little bit. So the way that anxiety affects us is going to be different from one person to another, just because of how we are wired, uh, what our experiences are, and how that has shaped us in some way. So how does this relate? And when we talk about anxiety and we talk about stress, are they the same thing? Not entirely. They're not 100% the same thing. And stress, a simple definition of stress is that's when those external demands are greater than our internal resources. I was just talking to Joanna as we started this session. Is over the last couple of months, it's been kind of a busy time at work, and that for me, that is something that creates a little bit more of that stress. Okay? And stress can be a good thing. Same thing with anxiety to a degree too. And there's been plenty of studies with this. People will perform a little bit better when there's the right amount of stress or the right amount of anxiety. They found this for competitional events. They found this for work events. To have a little bit of that stress or a little bit of that anxiety can be a good thing. But there is definitely a trade-off. Having a little bit is okay. Having it to where it overwhelms you is not okay. And so if you have too much, that benefit quickly becomes a detriment. So when we talk about stress, that's really when those external demands are greater in those internal resources, and it's not always exactly the same as anxiety. So anxiety, what is it? When does it occur? Okay, who does it affect the most? And I'm going to make. I'm gonna see if some people will respond to this, and I know that this is. I'm going to take a small break from the presentation and see if some people would be willing to offer their answers to these questions, and see as a group to see, what is anxiety, when does it occur, who does it affect the most, and we'll kind of get into what some of those other definitions are. So I know it's a little bit different. You don't need to unmute your screen or do anything, and I think that's a great thing over Zoom. But I do want to see if I can get a little bit of participation from you guys. So if anybody would be willing to answer this, and so we'll take just a minute or two to see if we can have some of those come in. So I do see some chat functions coming in. And I see Joanna just sharing the slides. Okay. So we'll see if we'll give it a couple minutes and see if someone would be willing to come forward and see how they would define anxiety. All right. Okay, I'm seeing being really okay now. Yeah, they are coming in. Thank you guys. Okay, being really stressed out. Yes, that can definitely be anxiety. Uncertainty about the future. Definitely. So that is a very specific type of anxiety. So yes, that feels like a lack of control. I think I don't know if it could be said much better than that. That really is. It is a lack of control. It's more persistent, more internal. Is it anxiety is more persistent, more internal than stress? Could be. Yes, it could be. I think with anxiety, it brings a lot more worry, and I don't know if stress always brings the worry. And anxiety, one thing that we're going to learn with a lot of anxiety disorders, it is persistent. That is definitely a big piece of it. But for many anxiety, it will wax and wane over time too. A sense of disease, okay? Overwhelming fear, okay, absolutely. Nervousness, anxiety to me is nervous feeling in my stomach, repetitive thoughts, feeling very panicked. Thank you so much for jumping in with these responses. These are excellent, and I really enjoy the participation. These very, very excellent. So I'm going to go back into I'm going to going back into sharing my screen. So I'll go over some of those clinical definitions of what anxiety is. When does it occur and who does it affect the most? Okay. So what is anxiety? So anxiety is going to include an anticipation of a future threat. Okay. Now it can be intertwined with fear, and fear is kind of defined as that emotional response to a real or perceived imminent threat, and that anxiety is that anticipation of that threat. So now anxiety can be very much associated with muscle tension, avoidance, vigilance. Some of you even commented about this, some of those somatic connections. My stomach doesn't feel well. It overwhelms me, okay? When does it occur? Okay, and this can be different for a lot of different people. It can be caused by different environments. For some people, it might be a social environment. There is a definite social anxiety. We in the Learning Center, we work a lot with learning disorders, and intertwined with those learning disorders oftentimes is anxiety. And so I'll give a couple examples of this. One of them is test anxiety. We work a lot with those with dyslexia. And a lot of those with dyslexia have those fear, that anxiety with having to perform in front of others, having to read in front of others. They have this disability, and they have this sense or this worry about looking stupid or being humiliated because they can't read in front of others. And so that can be very much interlinked. But anxiety can be, we could talk about specific phobias, spiders, snakes, heights. We can talk about a generalized presentation. We can lump in, and many people will consider post-traumatic stress to be interlinked or connected with that anxiety. And we also have separation anxiety. This can be fears of being separated from others, or just fearing that you'll lose others. So there is a lot of other anxiety. So when does it occur? It can be different across how we as individual beings experience life and are taking in the world around us. Who does it affect the most? Okay. Generally, anxiety is going to affect females a little bit more than males. And depending on the type of anxiety, it will affect others more. When we get into the different types of anxiety, there are certain types that occur more in developed countries compared to underdeveloped countries. And so that talks, there is a difference in society that may trigger that anxiety that we are feeling. Depending on other types of anxiety, there are differences when it's going to affect in childhood versus adults, or different developmental stages. So there's multiple answers to a lot of these questions. So I'm going to quick see the chat here real quick. I see one more coming through, making sure that there's nothing that I'm missing. Okay. When we start talking about anxiety being a disorder, we're going to say something that there is excessive fear or anxiety. So that excessive is a really big piece of it. It needs to usually last for an extended period of time, usually 6 months or more. And if it is treated early, a lot of times there is greater success to address this. So even finding this, identifying this earlier on can be very helpful. And I'm sure that many of you have already heard that it can present and manifest differently for different people. We heard some people say that they feel like their stomach doesn't feel well. When I get anxious, I can definitely feel a lot more worry. And I've noticed a little bit more of that as I've grown older. And there's some things that trigger it for me. For me, one of the things, if I have too much caffeine, I can become much more worrisome and have a lot more of that anxiety. So I really try to keep my caffeine intake down. So there's a lot of things that really go into anxiety is one of my main messages here. When we talk about an anxiety disorder, and actually anxiety as a whole, there's been recent studies that show that one in four of us, 25%, will experience clinical levels of anxiety at one point in our lives. And so 1 out of 4, that's a good chunk of people. I was going along with this thought, and I was saying, anxiety presents differently with different people. With children, a lot of times it can come back as just being irritable, or they might struggle with attention. And sometimes people will even think, this could be an attention disorder. It's not even an attention disorder. It's anxiety that's impacting their ability to regulate their attention. So there's lots of presentations with this. Okay, I'm going through and making sure I haven't missed anything in my notes. Okay. I do have a question. Does anxiety intersect with depression? Absolutely. There is a very high connection with depression. There's a very strong comorbidity with it. And sometimes anxiety can be explained by depression. Sometimes depression can be explained by anxiety. Sometimes they're both that are occurring at the same time. And that can be very difficult to unravel and distinguish. So that absolutely can go hand in hand with depression. Excellent question. So I talked to this to some degree, is that subjective experience, okay? And I've got a few points here, is evaluation, expressive, experiential. I'll kind of dive into what I mean by all of those. So one, evaluation. So if we see something coming across our way, we're going to evaluate as, is this something being as aversive? Okay. And I already told you that my mom, bless her heart, is very fearful of snakes. So that is something she sees that in her environment, and that is seen as being aversive. She evaluates that as aversive. I do not. But there are some things that might be a little bit universal as we'd evaluate as being a little bit more worrisome. I'm pretty sure that if we were thrown into a pit with a whole bunch of lions, I think almost everyone would see that as being aversive. Or if when we put our foot on the brakes and in the winter and we start to slide down the road, I'm pretty sure that we probably feel a little of anxiety at that point in time, a little bit of not being in control. So there are some things that when we evaluate universally, some things are going to be very subjective to the person. Now, how we express our anxiety is also going to be very subjective. I said, like a child, they might seem a little bit more irritable. they might seem a little bit more clingy. Um, and this can be for adults as well. They may shut down. I've worked with plenty of clients and families where when they get too much, they get too anxious. They just shut down and aren't able to handle it. I have a 6-year-old daughter who's a little bit more explosive when she gets anxious. When she gets worried about something, you can tell she also gets tense, and then she can react in a manner that can be problematic in given the situation. And it's experiential. So a lot of this is going to be based on the experiences of the events and our past experiences, both in the present and the past. So I can tell you that my mother's fear of snakes is probably based on an experience that probably did not go well with her. There's probably some connection in the past that caused her to be fearful. And that really plays into that subjective experience. Is we all have our own experiences. We've all had our own events that have happened in our life, and they can be interconnected with that anxiety. I'm going to show you a clip of how anxiety can actually even be learned. So where does this anxiety come from? And I'm going to go into a little bit of the Psych 101, and some of this might be review for some of you. And I'm going to go into some of my pictures of the brain here pretty soon. Joanna might be a little sick of this joke, but I don't know if I can do a presentation without showing a picture of a brain. So it's just what I do. But going into those nervous systems, we have two main nervous systems within our bodies. We have the central nervous system, which is going to include your brain, your spinal cord, those things that send out a lot of that information to the rest of our body. And then we have our peripheral nervous system, which is made up of two sub systems, your somatic and your autonomic. Okay? So your somatic is going to include your nerve fibers for sensory information and transferring that information to the motor nerves, and that will connect to our central nervous system. And then we have our autonomic system, which includes some more of those automatic processes that just generally occur. Okay. And within that autonomic system, we have the sympathetic and the parasympathetic. Okay. And some of you might be going, why are we going into this? Why are we going into this biology? This is when we consider anxiety and we consider the treatment. This is really the basis of a lot of our understanding of where this comes from and how do we address it. Okay, so the autonomic system plays an enormous role with stress and anxiety. It's aroused when there is stress or anxiety that puts the body into that survival mode. And this is really a natural response. It's an evolutionary response that is meant to put us back into a place that is safe. Okay, so survival mode, that sympathetic system. So if we start talking about that fight or flight, that's what's going to be happening. So that sympathetic, if we see something in our environment that stimulates this, our pupils will dilate, our heart rate will increase. We may start to sweat. We might feel cold and clammy. Our muscles may tense up. Other things happen in our bodies. Some of our organs actually shut down. So our body says we need to get out of this situation. It starts to shut down our digestive system, but it starts to operate and give us some of that adrenaline to give us a little bit more of that energy to keep us alert. Our breathing may become deeper to make sure that we have enough oxygen to our blood. Or enough oxygen in our blood that can go to our muscles so we can fight or flight. So an example of this is if I'm going through the boundary waters and I really like to canoe, fish, and so if I'm going through the boundary waters and I see this big shadow that looks like it's a black bear, or even a moose. My sympathetic system might engage, and I might get ready to see, what do I need to do to get to a situation to keep myself safe. Okay? Now, let's say that I see this shape that looks like a bear, and then I turn around the corner, and my sympathetic system is just engaged. It's rearing, it's going. I'm ready to either run or fight for survival. And then I peek around the corner, and it was just the way that the sun was shining off a tree, and it was nothing to be nervous of in any way, shape, or form. Okay, so that will engage my parasympathetic system. The parasympathetic system is is meant to get us back into that level of being normal functioning, back into that level of homeostasis. So it gets us out of that sympathetic system and into a mode where we can operate more smoothly. Okay. So this is what happens when we are experiencing anxiety. Is that sympathetic system becomes aroused, and there's parts of the brain, parts of the body that go into that. So some of us said that our stomach does not feel well. Okay, so that might be one of those symptoms. So we might feel our heart race, we might feel sweaty, or we might feel cold and clammy. So there's different things that are occurring, and what we need to do to help get us away from that is engage that parasympathetic system. And one of those other things that we can do to really help control and manage that anxiety is to keep that parasympathetic system in place and going, even at that first sign or before that sympathetic system engages. So knowing yourself, knowing the situation, knowing when you need to do some different strategies, that's going to be very, very important. So going into the brain. So very simply, the brain, we're going to be talking about that frontal lobe, that executive function. This plays a big piece into that controlling that anxiety. So this controls a lot of your executive function, your ability to shift, transition, but it also lets you kind of think strategically. How do I plan? How do I work through this? So we need to engage that frontal lobe of our brain and not let the limbic system, which is going to be more in that center part of the brain, get overly agitated. So we want that to engage that prefrontal cortex to help us guide us through those anxious symptoms. Your parietal lobes, okay, are going to include a lot of your motor and sensory information. Occipital is going to do a lot of your vision. Cerebellum is controlled with a lot of the motor. And then your temporal lobe, that's where we're going to be spending a little bit more of our time in kind of the medial part of the brain. Okay, so one of the things that happens is the thalamus will get a lot of information that comes in through sensory pieces, so smell, vision, taste, actual feelings of the skin, and it's going to help lead to diagnosis and refers to the specialist. It's going to tell where things go. Now, sometimes there are some things that go right into, some things bypass that thalamus. And one of the main central points that lead to a lot of anxiety, and a lot of research has focused on the amygdala. And from the start of this presentation, we talked, but I showed you that model that had lots of things going into it. And at that center point was that amygdala. And this triggers a lot of that fear response, a lot of that species specific defensive behavior. And what I mean by that is, for us, I went over a lot of those specific defensive behaviors for humans. Pupils dilate, heart starts to pump. For a dog, they might show their teeth. That is a defensive mechanism to say, hey, be careful around me right now. I'm in a defensive mode. So that amygdala really triggers a lot of that defensive behavior. It is also interconnected with a lot of fear-related or emotional memory. Okay, it can receive input from the thalamus. Okay, but one of the things I really wanted to highlight was right here is I tried to click and highlight. It does have some single neuron responses for visual, auditory, and somatic. So what I'm saying here is that there is a highway that goes right to that amygdala so that that thalamus doesn't even need to interpret the information. And that's meant so that there's a faster response. So it helps in those moments of survival. And so if something is not seeming right, um, you know, if I wake up in the middle of the night and I hear like someone's entering my front door, my amygdala is probably going to be engaged right away, and I'm going to be put right into that fight or flight mode. Okay. Now we have found out that there's a hyper responsiveness of this amygdala with certain disorders, especially with PTSD, and its activation is very well connected with social anxiety disorder. Interestingly, kind of like muscles of our body, if it gets overused, it does tend to grow. So if we use certain muscles over and over again, we do build those muscles. The amygdala is something that can become hyper utilized, and with those with a lot of anxiety, this is something that can grow. But the converse of that is also true. As we start to use some of these daily living management skills doing therapy, we can see a decrease in that volume, which also helps decrease those aversive responses to those things that we perceive as threats. Okay. I'm just taking a small break to make sure that there's no questions. I already talked a little bit about this prefrontal cortex, okay? And this where there's a lot of emotion integration. And this happens in the anterior cingulate cortex. It interprets higher order significance. It helps determine behavioral responses, appropriate behavioral responses that can fit the environment. And it does have some of those connections with the amygdala, and it can help attenuate those fear responses. So I was saying that this needs to be engaged as we start to feel some of that fear or worry. And one of the most effective means to control the worry is a cut it to behavioral approach. Is we want to use some of those behaviors, but we also want to say, this threat is not something I really need to worry about right now. What are some strategies? What are the real concerns with this? Is this really going to occur in this situation? And using some of those cognitive pieces to say, calm down. This is not something we need to worry about, and that helps us slow down from some of those fear responses. Okay. The hippocampus. Okay, this is also connected within that limbic system. It's a part of that limbic system and connected with the thalamus and the amygdala. And the hippocampus is thought to be a strong connection, or one of the main functions is to be doing a lot with memory. Okay. And so this can also be very interrelated for PTSD or for other anxiety that might be linked to responses or environments or experiences that were negative to us in the past. Okay, it helps us retrieve long-term memories, and we have seen that the volume and growth of this is linked to stress sensitivity and anxiety disorders. Okay, and we can see as we approach this through therapy and other means, this can decrease as well in size. And the one that I haven't talked about yet is the hypothalamus. Okay, and this helps regulate behavioral and physiological activities. So this can be very much connected within that parasympathetic system. So this is part of those things that the hypothalamus may get shut off to some degree as that sympathetic system engages, because that parasympathetic system engages, the hypothalamus is really working. Okay. All right. Just to want to make sure there are no questions, I'm going to talk about some of the presentations of different types of anxiety. And some of this does get into prevalence rates and how often does it occur. And for some, this might not be the most interesting part of the presentation, but I will tell you this is it is kind of good to know like some of these different presentations of anxiety. So it helps us identify it earlier, and it does help us kind of show us like what type of approach is needed. And some of these things may surprise you. So I'm going to start off with generalized anxiety disorder, but I'm going to give a quick minute. Are there any questions before we start getting into this on any of the topics that we've covered so far?
Nope, I don't have anything in the queue.
Okay. I'm going to give us just 30 seconds to see if there is anything that pops in. And maybe just give my voice a little break too. I will tell you that for those of you that are out there doing a presentation through Zoom, and I'm sure that many of you have had the chance to do that, but it is a little bit different from being able to see faces in the crowd, and sometimes you can see if someone looks a little confused or perplexed and knows when to stop. And so it's, to me, I think doing it through Zoom is a bit more challenging. But for you guys, and the presentations I've gone through, it's also a little bit more welcoming too, to some degree, because the ones you get to, you can show up in your sweatpants, you can turn off the screen, so and just listen along. So that is also pretty neat. But I don't see any questions, so I'll get back into, oh, I do see one maybe come through. Okay. Is becoming excessively sleeping in class a common way that anxiety manifests in teens? Okay. The manifestation can be different, but I will say that is probably not a routine or a common way that it manifests. Because generally, if we go back to kind of what we were talking about, anxiety is going to cause us to increase how our body is responding. So our heart might increase. We might have some of the other somatic things. So generally, anxiety is going to heighten our alertness to specific things, and it's generally going to be linked more to you not being able to fall asleep. Now, I would think that sleepiness might and could be a little bit more of a sign of a depressive tendency, and that would be my answer to that. Does that mean that anxiety cannot be linked to feeling tired? And I guess so looking at it a little bit more deeply, I guess it could be. So let's say that that your reading class causes a lot of anxiety, and you are just ramped up and feeling really anxious, and your body spent a lot of energy when you're in that reading class, but then you go to your next class and you start to settle down. You spent a lot of energy in that previous class, and now you might be feeling a little bit more fatigued. So I guess maybe it could be. So it can be connected, but I would also be looking at depression as being a part of that, is what's going on there. If anxiety is causing you to stay up late at night, and that is a big piece of anxiety, yes, it could cause fatigue there too. There's a big gray box in front of the slide. Can't read the words. That is because, thank you very much. That is just simply because I'm reading the questions that are popping up. And I'm guessing now the gray box is gone. Is that the case, Joanna?
There's still one up top, but the big one in the middle is gone.
That must be my, let's see if I can get this to, it's my control features for Zoom
Oh,
and that are popping up.
okay.
Okay. Okay, interesting question. So I'm reading one more comment. So I did say that one person says that this happens to me. Someone says that they yawn like crazy, they get very sleepy when they are nervous. And is there a difference between nerves and anxiety? I would say that there is a difference between nerves and anxiety, but they could also be very, very similar to each other. And I went a little too far in my slides. I did a little too many clicking. So nerves to me, it could be, if it's so significant, yes, I think it could be anxiety. But like I was saying, that anxiety exists on a continuum, and you might just have some simple nerves. I was a runner in high school, and I would get nervous before every race. Now I wouldn't say that I was anxious, or if I was anxious, it was very much at that lower level. But if there was a little bit of that didn't affect me, but it also got me in the right mindset. Now, if those nerves are excessive or very significant, I probably would call that anxiety. So I hope that answered that question. I'm going to make sure there are no more questions. And so I did hear some people that say that I do feel a little bit more tired and things that they attribute to anxiety. And so that's interesting to hear. I would still say that we would probably need to dissect that a little bit more, but this kind of goes back to one of those first slides, is that experience of anxiety can be very subjective in nature, and that experience, some people may definitely feel. Okay. If I talk about generalized anxiety disorder, and this is probably one of them that is the most commonly referred to, and probably one of the most diagnosed. And this is coming from our diagnostic manual on how we diagnose an anxiety disorder. So it includes an excessive worry most days, more days than not, and it can be about a number of events or activities. So it's not as focalized or specific. Okay, it can include 3 or more of the following: restlessness, fatigue, concentrated or mind going blank, irritability, muscle tension, sleep disturbance. Now, this is where I said it can affect your ability to fall asleep. So if it's causing you to get the less than recommended amount of sleep, that also might mean that the next day you might be feeling more groggy or more apt to falling asleep. So now what's interesting about this is when I talk about that this needs to occur in 3 or more, you need to have 3 or more of these. In children, you need 1. Okay. A lot of our kids that are really young and they can't name it, and this is hard. They can't name that I'm feeling anxious. They don't understand that word. And you might be seeing it as being irritable. Okay. You might even see it as they have difficulty concentrating. And it might not even be that they have difficulty concentrating. They have difficulty concentrating on what you are talking about or what the task at hand is. But their concentration is more consumed by their anxiety. I'm worried about this. I'm really concentrating, fixated on whatever's causing that anxiety, that they can't expend the energy to concentrate on what is being assigned. Okay. They can have muscle tension. They can have that sleep disturbance. They can feel fatigued. And so this does kind of really get at what some of those comments are, is they can feel really tired. Prevalence rates for this. So generally, this is something that occurs a little bit more frequently in adults. In fact, the median onset age is 30 years. It is supposed to be about 1% in adolescents, 3% in adults. It occurs in females about double the clip as in males. This is one of those that is much more common in European descent populations. Also one that is more common in developed countries. Okay. Now, I want to take a little moment and kind of sit on that. Is we do see a little bit more of generalized anxiety disorder coming in the United States, in France, in Great Britain, in other developed countries, Australia, Japan. So this anxiety, to some level, is kind of a systemic problem. When we talk about the U.S., it's one of those things that the things are constantly in motion. There's a lot of demands on us. We are in a production-driven type of mode, and this does put a lot more anxiousness on us. And so, by a product of our production, we have created a lot more anxiety. And so that is a byproduct that is not really great. And we're moving at a very high pace. And because of that, one of the things that occurs more often is an anxious disposition. Now, with generalized anxiety disorder, symptoms wax and wane. Okay? And full remission rates are very, very low. So there are times in your life where you might be managing it pretty well, and they might not be as persistent, or persistent isn't the right word. They might not be as presenting. But other times in your life where they're really going to be triggered, and they're going to manifest at a much more expressive means, and you'll go up and down throughout your life. Okay. Generally, as you grow older, in your 50s and 60s and 70s, a lot of these symptoms will dissipate a little bit more. Okay, and then they can increase a little bit more as you go older, and get into more of your older years. Then that can co-occur with some of that mental decline. Okay. And I'm seeing some chats and some questions.
Yeah, I was going to say we have a few questions, Ethan. First one is, how do you discern ADD from general anxiety?
Yep. And that is a very, very difficult question. Okay. And when I say when I talk about ADD, I'm probably going to refer to it as ADHD. And so when a lot of that, so if you hear that, I still might be talking about the attention difficulties without the hyperactivity. So if you hear me say ADHD, don't think that I'm excluding ADD. So there are some things that you can do to do that. One is you measure those symptoms of anxiety. If we do have a lot of attention issues that are occurring, and we are not seeing a lot of that anxiety, it probably is an attention issue. Other things that we can do is there are some neuropsych assessments that we do that kind of help delineate that, but even those are not perfect. And you can have both, which can make things a little bit more difficult yet. So one of the markers is getting as much information as you can. And sometimes we can identify when your mind goes blank, and is that connected to a specific trigger or a specific thing that causes that anxiety. Okay. If we can do that and it doesn't occur in other situations, we can say this is probably anxiety, and it's probably not an attention ADHD or an attention disorder. But there are times, and I've been doing this for over 10 years now, and even for us that do this on a day in and day out basis, that can be very, very difficult. And it can, that it needs to be treated very delicately, because one of the things that can occur is if we call something ADHD, one of the most common treatments for ADHD is using stimulant medication. And for those with anxiety, that can really increase that anxiety that they are feeling. So it takes a little bit of time to figure that out. Now, sometimes ADHD can cause anxiety. Sometimes anxiety can cause ADHD, and that's difficult to tease apart too. So the answer is it is really difficult to do so. I see another question coming in. I see something in the chat. What kind of treatment can you do for anxiety? One of the most common treatments that you are going to see is going to be therapy and a cognitive behavioral approach. So you're going to want to put some behavioral things in place. And we're going to talk about that a little bit. I'm going to go over some of those behavioral things you can do to help you engage that parasympathetic system and get your body a little bit more regulated. And then you do some cognitive training to help you address some of that anxiety. And especially if you can find some things that really triggered your anxiety. For some people, that's pretty easy to identify. It might be taking a test. It might be driving during rush hour. There's lots of different things that could cause that anxiety. So it's what if you can identify that, that's going to help you with some of those cognitive things that you can train yourself to do to help combat that. Is anxiety more common in adoptees? That is a good question, and I don't know if I have the answer to that. And I apologize, I don't know that, and it very well could be. And we do see a lot of those adoptees. We see a lot of them that have anxiety. Now, I will tell you this: there is certain types of anxiety that is definitely more common among those with adoptees. Is generalized anxiety disorder. It all depends on, I would say it'd probably be dependent on what the situation was like before they were adopted. If they were brought up in a nurturing environment and or if they were adopted right at birth, I don't know if there would be a greater increase in anxiety. But for those that were in orphanages where they might not have had that connection with others, or they didn't know where their next food source was coming through, or there was a lot of things that where they were in that survival mode more often, I would say generally, yes, there would be an increase in anxiety for those populations. Okay.
I think we have one more question too. Does ADHD medication stimulate anxiety because it is often a stimulant?
The answer to that can definitely be yes. And I have worked with those that were being treated for ADHD, and you could almost see it, it was more the anxiety. And they were on a stimulant medication, which did help their focus, but they were almost manic in their presentation. And so that was not good for them either. And so getting at the root of that and then starting treating that anxiety first, that went a long ways. Now, a good way to really delineate, and this kind of gets back to that initial question, is there is research that comes out that like a therapeutic approach can work for those with anxiety. It can work with those with attention problems as well. And through that ongoing relationship with a therapist, you can gain more information and more insights of how this is presenting and manifesting. And that helps you dissect whether this is an anxiety disorder or an attention disorder or both or neither. Now, another type of an anxiety disorder is separation anxiety disorder. And this is characterized most often by excessive fear or worry about separating from an attached figure. Okay. It needs to occur at least 4 weeks in children, at least 6 months in adults. And it can be affected considerably by cultural characteristics. There are certain cultures that are much more that are. If we think about the U.S., we're a lot of times we're raised to be very independent, but there are other cultures that out there, like Eastern cultures, where there is much more of that cohesiveness and that working together type of thing, and so there are different cultures that have a lot more of that separation anxiety. Now, this doesn't need to be just that you're worried about being separated from an attached individual, like the physical separation. It can be some of those worries about being lost or kidnapped. We can see this we can see this related to not being able to sleep next to an attached figure. So a lot of times children may not want to sleep away from mom or dad. We see this for kids entering school. If they don't want to be mom or dad, you can see them clinging on to mom or dad. They don't want to enter school. And for some kids, they need to have specific plans to help them get over that separation anxiety and enter into school. This occurs in about 1 to 2% of the population, more often in children, and this decreases as you age. This one is equal for males and females, so there isn't that split. Okay. Social anxiety disorder. Okay, and this one is I think I got some very interesting things to kind of cover with that social anxiety disorder. And this goes with that marked fear or anxiety with specific social situations, performing in front of others. Okay, so if I had higher levels of social anxiety, I might not be able to come out and talk in front of you guys. You have a lot of ways that you're going to be humiliated, be rejected. People are going to think that you're stupid or not worthy. So this can be connected a lot with learning disorders like dyslexia. I don't want to read in front of others. There can be some of that social anxiety. It can also be just, we can think of someone that is a little bit more introverted. And introverted is not its own, it doesn't mean that you naturally have anxiety, but some of those that are more introverted may be a little bit more prone to some of the social anxiety. And they just do a lot better within those smaller contexts. Now, another twist to the social anxiety. Most commonly, when we talk about test anxiety, this is where we categorize it, is underneath this social anxiety, because there's a lot of fear that I'm not going to live up to expectations, that the professor, the teacher is going to mark me incorrectly. I'm going to be presented that I'm being stupid. There's a lot of that we wouldn't think of taking a test as a social situation, but there is a lot of that performance fear that occurs with taking a test. So this is where we usually see that test taking anxiety. It needs to be present for 6 months or more. In about 7% of the population in the US, this is lower in other parts of the world. And this can decrease with age. This is one that's a little bit more higher with American Indians, but lower with Asian, Latino, and African American populations. Okay, a little bit higher rates of females than males, but not at that 2-to-1 clip. Now, in children, we might see this a little bit earlier on. We might see more of those crying, those tantrums, those freezing, that clinging, that failing to speak. Okay. We have also seen this one to have a stronger genetic component. This runs a little bit more strongly, and with all anxiety, it runs in families, but social anxiety is one of those that runs a little bit more deeper within families. Okay, and I see a couple Q&As pop up.
Yeah, it looks like we have a couple. First question is, if separation anxiety disorder isn't treated, but gets better with time as the child grows, can there be lasting effects?
Okay. So one of those, if separation anxiety disorder gets better as you age, okay, one could plausibly argue, was that a disorder in the first place? And maybe it was, but can there be lasting effects? My answer to that would be a resounding yes, and how that might change from individual to individual, and with generalized anxiety, we said there can be some waxing and waning. And so how this presents, I would not be surprised if some of these other presentations can have some of that waxing and waning. And I want to also make sure that I cover this waxing and wane as I start talking about accommodations. Okay. How can a parent help a young child with ADHD, with separation anxiety, in relation to a divorce when that child is showing all of these symptoms? So I would, that's difficult, right? As much as we can is taking a multimodal approach to this. We have an environment that can be highly stressful, highly anxious for that child, and with parents that and caretakers that are separating, that can create a lot of child. Now, one of the best things that we can do is working through a therapeutic relationship in my eyes. And when we talk about therapy, it really should be done with someone that they can build that strong rapport with. So if they have someone that they can connect with, that they can talk through these things with, and develop strategies to work through that, the better. I would say that trying to, and this is really difficult in a divorce, is trying to make it as cohesive as possible. And I've witnessed a lot of children that have been affected by divorce, and I've worked with families where the parents are separating and they are a little bit more amicable, and I've seen it where it's been very contentious. And as much as we can keep it amicable, and that's going to have a good benefit for the child. But I also that's not always the case, and that it won't always be amicable, and that might be the whole reason for the divorce. So as much as we can do is take a multimodal approach. Therapy is going to be very, very helpful. If we can include a family component of that will be very helpful. And then just to make sure that we are connecting with as many of these other things that will kind of be protective factors. So if we can keep them involved in activities, sports, exercise, making sure that we get good sleep, and we're going to go over a lot of these. So as much as we can do those things that can keep you protected, you're going to have better outcomes. And I'm seeing a few more chats. What can a parent do to help a teen or college kid to prefer of others? And how can adults overcome fear or anxiety in public speaking? Okay. And these questions kind of go hand in hand to each other. One, and when we start talking about things when it's very specific, one of the best things that we can do is learn how to desensitize them from the situation. Okay, and this takes it takes a little bit of that cognitive behavior support. Is one is we talk about the fears of speaking in front of others and the fears that come with that, and kind of show how they are irrational and kind of target those cognitive feelings that we're thinking. But the other aspect is very much behavioral. And kind of like when we have a specific phobia with spiders or with snakes or with speaking in front of others, we will start to expose them to that in smaller increments. And we move them through, speaking in front of a microphone, and maybe just speaking to the therapist, and then maybe speaking to 2 or 3 people that they don't have a lot of fears for, and then gradually build up. It's kind of like learning how to ride a bike, is one step at a time, taking small increments, and you desensitize from that fearful situation. So that's the same thing you do with a teen or a college kid, is you might work with them with speaking to you at home, work with someone that they feel comfortable with, and then you go into other smaller or other scenarios, or you might have them go speak at an event where they don't know anyone. Kind of like what I'm doing with you guys right here is unless I went into who signed up, and I haven't done that, is so much speaking to people I really don't know who's out there, and that can reduce some of that anxiety too, because it's not someone that I would be worried about thinking that I'm stupid or that I don't know what I'm talking about. So it's kind of those baby steps and those small steps to get them into speaking. And these are excellent questions. And I do want to say that I very much appreciate the questions. It is very helpful for me to kind of take a break and answer these specific questions and jump into them. And it helps me think of some things that I very much appreciate that. And I'm sure that many other people are thinking some of these same questions. Okay. And I just got a message that my internet is unstable. So if I do, if for some reason I'm logging back off, I'll connect with Joanna and see if I can get right back on. Okay, one other one that we've talked that I alluded to a little bit earlier is post-traumatic stress disorder. And within our diagnostic manual, this isn't really lumped underneath an anxiety disorder any longer, but it is very much connected. So when we talk about post-traumatic stress disorder, this is where you have a lot of exposure to actual or threatened death, injury, or sexual violence. Intrusion symptoms such as recurrent and intrusive memories, dreams, prolonged psychological distresses occur. You have persistent avoidance of the associated stimuli. If you have been a victim of a violent crime, or if you witnessed it, or if you've been associated with it. The events of George Floyd, that has created a lot of PTSD, and a lot of this is something that can be much more common among those that are non-whites, and that's because of a lot of those barriers, or the racism and the things that the stress that comes along in some of those situations, or some of that minorities feel very commonly, that can relate and lead to a lot of post-traumatic stress. So it could be associated with a lot of negative alterations of cognitions, moods. This is one that we definitely screen for when we talk about ADHD, because this is something that can definitely cause a lot of troubles with concentration. The lifetime prevalence for this in the US is about 9%, and sadly but true, it's more common in females. They are going to be more likely to be victimized, both through sexual abuse and through physical abuse. So this is something that is continuing to get studied more and more, and we have a greater understanding of it. And definitely those that have seen action in wars and in violent situations, there can be a lot of post-traumatic stress. Okay, I see a chat on this one. Has there been a correlation to mindfulness and reduce anxiety? Yes. And when we start getting into here real shortly, what are we going to do about anxiety? We're actually going to do a mindfulness exercise. Um, so we do have about 15 minutes. So I'm going to kind of jump into, I'm going to show you a little bit of this learned exposure to stress and anxiety. And then I'm going to jump into um, um, to some of the things that we can do about it. So I'm going to show you a little video of how this anxiety can be learned. It kind of gives you that real life depiction. And it's one of the worst psychological studies that have been done. And if you know about the field of psychology, when we were starting to learn and study human behavior, we did some pretty egregious and terrible things in our studies, things that we could never do today. And so here is one that is Albert and the white rat. So I'm going to need to share a new screen with you. And it should work. You should see, oh, I went to the wrong screen. Hold tight. I'll stop my share and I'll go to the right screen. I'll just click on the link and it'll pop up. Okay. I apologize. Thank you for being patient. All right. You get to see a little.
That is usually covered by her phone has finally made an appearance.
All right.
In the early part of the 20th century, psychologists John Watson and Rosalie Rayner set out to teach a baby boy called Little Albert to fear white rats using the principle of classical conditioning. This is a film of their work. The film shows several phases of their study. First, as you see here, the investigators demonstrated that prior to conditioning, Little Albert had no fears of any animals, including, of course, white rats. Watson and Rayner then sought to teach Albert to fear white rats through classical conditioning. In the conditioning phase of the study, which was not filmed, the investigators struck a steel bar with a hammer whenever Albert reached for a rat, making a very loud noise that greatly upset and frightened Albert. After 6 such pairings of the loud noise and the rat, it was believed that the boy had been conditioned to fear white rats. That is, Albert was now expected to react fearfully to white rats whether the rats were paired with loud noises or not. In this next film sequence, we see Albert interacting with a white rat after the conditioning process. The investigators believed that the child's reaction during this trial demonstrated his newly acquired fear of white rats. Finally, the investigators expected that little Albert's conditioned fear of white rats would generalize to stimuli that were similar in key ways to a white rat. In this film segment, they were trying to demonstrate that the child now also reacted fearfully to similar objects, such as a rabbit, a dog, a furry object, and a white mask worn by Watson himself.
So I've got my essay written, and I've been working on it for about a week. So now I'm going to show you how I use Grammarly.
All right, I'm going back to the presentation. Hold tight while I get this pulled up. Yeah, so that is one of the most mean experiments that have ever been done. Now, what is interesting is when they've done studies of anxiety, what they've found is those that have more anxiety, like little Albert, they're he had an association between these stimuli and having fears involved with it. Those that are naturally anxious or that have anxiety disorders, they have a stronger disposition of having those pairings connected and having those, associating things that shouldn't be fearful with things that are fearful. So then we talk about extincting or moving those behaviors into extinction. And what happens with that is we just try to break the association between the stimuli and the fearful response, but we don't get rid of previous memories. All right, so the questions are, what do we do about this? Okay, and this is where I get into that approach to really help support anxiety. And a lot of this is going to be general protective holistic approaches. So we need to be proactive. We need to understand our anxiety. We need to do things in our daily life that will help protect us against anxiety. There are many things that we can do with that, and we could talk about looking at our physical health. If we have good exercise. Exercise has been shown to have a lot of proven benefits. It can help decrease anxiety and help keep you in that level of homeostasis and reduce tension and stress. Healthy eating and watching what we eat, not having too much caffeine, avoiding sugar. Eating a healthy diet can go a very, very long way. There's a lot of new research that shows the connection between gut health and then your emotional health as well. So having support system, okay, and I added a few new slides to my presentation this time, and I'm going to show you some of my support system. So having a good, healthy support system goes a very long way. And that might include therapy, it might include your family, it includes other social connections. Anything that we can do within those can be helpful. Doing anything that engages in altruistic tendencies or altruistic behaviors, giving yourself to others, helping others, it goes a very long way with managing our emotions and feeling positive about ourselves. And then just simplifying our lives. As we noted in some of this in earlier, is some of this anxiety occurs a little bit more in our advanced, I'm putting that in quotation, society. And we're in a rush type of mode, and sometimes we just need to slow things down and get back into the basics. So I'm going to touch a little bit about on some of these holistic approaches a little bit more, and I get to brag a little bit because I'm the one that's presenting. But those protective factors, and for me, I do get anxious from time to time, but I've got a really good uh, uh, I got a really good support system. I have my dog, and you see that my dog is not too thrilled about his new Halloween costume. Um, but having pets can go a long way. And I go on a walk almost every night with my dog and with my wife, and that's a very good time to relieve some of that stress and that anxiety and just take a break from everything that's going on. You can see that I've got 4 kids, and at one point my kids were all 5 and under, and so um, that created a lot of stress in our household. Um, and I do see a couple questions, and I will get to those. So hold tight with that. But we do a lot of things together as a family. That I've got a really good, healthy relationship with my wife, and so this support system that I at home really does help me, even on those days that I might be more cranky and feeling more anxious. Okay? Things that I almost always talk about when I do an evaluation for someone, and in my evaluations with what I call my grandma rules, things that grandma would say that are backed by research. We need to, as much as we can, get as much sleep as we can. And we are also in a society that we have done a lot of trade-offs where we can get more work done if we don't sleep. I need more study and more time. And that does affect our ability to regulate our emotions, including anxiety. So we should be trying to get an adequate amount of sleep per night. I would highly recommend that we remove technology from the bedroom, and the bedroom should be really used for sleep. 9 to 11 hours of sleep for elementary age children, 8 to 9 hours of sleep for teenagers, 7 to 8 for adults. You will see some mild variations in these recommendations. This is from the National Sleep Federation. I think the American Academy of Pediatrics has just some slight variations to this, but this is going to be right in that general realm of what is recommended for sleep. I've already talked a little bit about proper diet and exercise. There was a question about meditation. Is meditation effective for anxiety? And it definitely is. It teaches us how to engage that parasympathetic system. It teaches us how to be mindful in our current environment. A lot of times there's deep breathing involved, and we're going to do an exercise with that here in just a second. Does anxiety and OCD correlate? Super strongly. I'm answering some of the questions. A lot of your obsessive compulsive tendencies are very much related to anxiety. And so, yes, they are very much interrelated. Are there vitamins, minerals that are better for anxiety? That there are vitamins and minerals, and I always confuse these vitamin D and vitamin B, the one that we get from the sun. So that can be very helpful with managing our anxiety. But really, just having that healthy diet that is rich with a lot of these vitamins and minerals, that's going to go a long way. And if you talk with a lot of dietitians, and a lot of those, they will recommend that you don't go look at vitamins and minerals, that you look at having that diet that has a wide range of food and that you get your vitamins and minerals through that diverse type of food that you eat. So let me go into some more of these things. I talked about proper nutrition. We want to reduce things that might make us more susceptible to anxiety. I told you that caffeine is a trigger for me. Well, caffeine is a trigger for many people. So we need to be careful with our caffeine intake. And I really like my cup of joe. I love coffee. But so I have to be very careful for how much caffeine that I intake. Sugar is something that is very much a part of our lives, and to a very negative degree. We talk about sugar, it's one of those things that will heighten our alertness and give us a quick energy burst for a very short duration, and then there's that crash. And then when you have that crash, that affects your ability to engage that prefrontal cortex, which allows you to manage and address your anxiety. So as much as we can do work with whole foods, the better that will be. And something that when I looked into sugar, and I've watched a few documentaries, and yes, I'm a little bit of a nerd that way, but if you look at what is recommended for additional sugar intake, when I talk about additional sugar, it's things that don't naturally occur in foods. So like generally your fruits and your vegetables are going to be they're going to be okay. But when we talk about drinking sodas or pops or having candy bars, anything, or having a cupcake, those are adding the sugar in. They recommend for men, adult men, that you have no more than 36 grams of added sugar a day. For women, that's 25 grams, okay? Or 9 teaspoons, okay? Really, that is 1 12-ounce can of Coke. That's it for an entire day. And so how often do we go above that? And even if you get 100% whole wheat bread, you're going to see that sugar's added in there. Peanut butter, sugar's added in there. There's a lot of things where they just infuse sugar into. So we are intaking a lot of this thing that cause for a lot of crashing in our functioning that affects our ability to regulate our emotions. So we do need to be mindful of what we're taking in as well. Okay. Are there particular types of exercise that are better for reducing anxiety? Is vigorous exercise more than low key than like yoga? No. Vigorous exercise is very, very good. I am still a runner, and I can tell that when I run, I do very, very well. But I also do yoga at least once a week. I did yoga this morning, and how relaxed I do with that. And there's been a lot of studies with yoga and things that are connected to yoga. Yoga can be super, super helpful for anxiety, PTSD, and many of those other things. So just engaging, going out for a walk and just breathing the fresh air. They've said that if you're able to walk down a trail and just see the leaves turning color, seeing nature, that can be a very powerful inhibitor of anxiety. I'm going to do a little mindfulness exercise with you. So I know that I'm coming up on 8:30, and I already am at 8:30. If you need to log off, know that this is recorded, and you'll be able to come back and do this. I want to be mindful of your time. I don't have a lot left, so I am getting closer to that where I'm wrapping up. But know that you can come back to this, and I know that you all live very busy lives. So please feel free if you need to log off and check back in. So I'm going to do a little bit of a meditation exercise, okay? And I want you to grab something that's around you. It can be any typical object. I have a pen that I'm holding on to, okay? And I want you to hold on to that. And hopefully you'll engage me with this. So I want you to close your eyes. I'm going to start with some deep breathing. Okay. And I'm going to tell you one way to do your deep breathing. And deep breathing is usually recommended as a way to calm yourself and to engage that parasympathetic system. And this is something you can do in any environment. If you're driving down the road and someone cuts you off and become angry, you can take a couple of deep breaths. Before you take a test, you can sit back and close your eyes and take a couple of deep breaths. This can be very, very helpful. Okay. So I want you to close your eyes, and I want you to breathe in very deeply through your nose, and to an extent that you feel that your lungs and your chest fill up with air, and I want you to hold. And then I want you to slowly let it out through your mouth, almost as if you are blowing through a straw. And then repeat. Breathe in. Exhale. And again, in and out. I'm going to give you a few more moments to do this a few more times. With your eyes still closed, we're going to engage the 5 senses exercise. With your eyes closed, I want you to notice 5 things that you can see around you. So you're going to visualize this with your eyes closed. And see if you can kind of describe it. Look at the color of it. Look the way how far of a distance you are away from it. While you're doing this, continue with your deep breaths. Now I want you to move on and notice 4 things that you can feel. I had you grab something, but you can also feel about how your clothes feel on you. You can feel about how tense your muscles are. You might even feel like how heavy your eyelids might be. You might be a little fatigued or a little tired. try to notice 4 things that you can feel and continue with your deep breaths. Now I want you to notice 3 things that you can hear. It might not even be much. It might be the air is blowing through the vent. It might even be just quiet and stillness. You might hear faint sounds of traffic on a nearby road. Now I want you to notice 2 things that you can smell. And lastly, I want you to notice something that you can taste. You don't need to put anything in your mouth, but you can kind of go through what that taste is in your mouth from maybe your last meal, or maybe from a candy that you have in there, or and it might be pleasant, it might be unpleasant. I want you to take a few more breaths and then open your eyes. Okay, now generally, I know that we're kind of getting closer to on time, but generally I'll ask how people are doing and after this, and how do you feel? And a very common response is, I feel more relaxed. I just feel a little bit more calm. I feel a little bit more at ease. And this is only just one exercise. And this was a meditative exercise, and there are many more exercises that are out there. And this, like I said, these can be done anywhere. You can take just a few moments each day when you feel the anxiousness with that stress that is being put on. You can just take a small moment and breathe. Okay, and that will help engage that parasympathetic system and reduce some of that negative effects of that anxiety. Okay. I do have some meditation resources for you. So websites like mindful.org, the University of Minnesota has a good website. This website right here talks about, gives you a guided meditation. One of my favorites is Mark, which is a mindfulness awareness research center out of UCLA. There's some good TED Talks to go to. If you type in YouTube, there's really good resources for meditation. And there's a lot of apps that are out there. Headspace and Calm are probably some of the most common ones. Okay. Therapy. Generally, therapy is found to be more effective than medication. And that is not to say that if you're on medication, you should stop, or that you should not consider medication. But with a good therapist, generally, that can be very, very helpful. One of the most common is a cognitive behavioral approach, which is going to be focused on understanding and changing your thinking and behavior patterns. Okay? And they help you learn new skills that you can apply through your life. And we usually see an effectiveness of this after about 8 weeks, and then more pronounced effects between 12 and 16 weeks. So it does take a little bit of time for you to learn how to use these skills and apply them. And working with a good therapist can go a long way there. Exposure therapy. I talked about this a little bit with oftentimes with fears or phobias, fears of speaking in front of others, or if I'm scared of heights, or if I'm scared of bugs. It's being able to push yourself to desensitize yourself from those fears. Okay? Acceptance and commitment therapy. So it's a blend of mindfulness and behavior change. Another really common one is dialectical behavior therapy. So it combines practices of CBT and mindfulness, and it uses both individual and group therapy. And there's interpersonal therapy. This is more short-term therapy to help address some of those interpersonal issues. So these are all really good approaches And we do have lists of therapists that are available. There's a lot of therapists in the Twin Cities. We have lots of great resources, and many of them are doing telehealth videos if you can't get there, if that's an issue. Okay, I also really like this suite of apps that's provided by Northwestern University. So this was developed by a grant from the Institute of Mental Health, and it has a lot of apps to help you manage and go through symptoms of anxiety and depression throughout your daily life. Okay. Now in school, what are we going to do about those that are really struggling? We can talk about a 504 accommodation plan. We can talk about having extended time, being able to take tests in smaller, quieter environments. A lot of times those accommodations are going to go a long way. And sometimes people say, how do we distinguish between anxiety and ADHD? In terms of the application, sometimes it really doesn't matter. We're going to be working on executive functioning skills, and we're going to be working on accommodations, and both of those are going to be pretty similar. Okay. All right, I did list some tips for dealing with anxiety and depression, especially during times during the COVID-19, and this comes from the CDC. Okay, so know when and how to get treatment and other support services. So therapy is going to be very useful, and a lot of the other things they say in here are news stories, those things that can cause a little bit more anxiety. We want to take care of our body, taking those deep breaths. We want to stretch. We want to meditate, eat healthy, well-balanced meals, exercise regularly, get good sleep, avoid excessive alcohol and drug use. I did not mention that, and those can be really triggering effects to anxiety. A lot of times there's this thought out there that cannabis or marijuana can be very helpful for dealing with anxiety, and it can be. But there's also other strategies that we can use beyond some of these alcohols or drugs to help deal with the emotions that we're feeling. Make time to unwind, simplify your life. I mean, so that's kind of what that's getting into. Make sure that we connect with others. So community or faith-based organizations can be really good. So I do have a lot of books, and I'll let you guys look through these. And there's a lot of good resources here on how to address anxiety for children and for parents. And I did list my contact information. Any additional questions? I'll stop my screen share right here. Any questions before we jump off? Someone said the what to do when books are so helpful. Okay, that is good. Do you have suggestions for local psychiatrists? Okay. Yes. So if you have particular questions about psychiatrists, you have my email address. You can email me. I'd be happy to share those psychiatrists with you. So just go ahead and email me, and I'll provide who we recommend to or who we refer out to. Oh, a question. Any suggestions on info about gut health? No, I do not, but I'm sure. So I might shoot myself in the foot for saying this, but Googling that might not be a bad thing, but just make sure that you get a reputable source. So Mayo Clinic, Cleveland Clinic. In fact, I think I read some recent articles. Like if you Google that, the Harvard Medical School has got some recent articles out there on that. So I'm pretty sure, like if you do the Harvard Medical School, you'll get some resources on those connections.
Looks like there's also another question that came in. You listed whole foods as something to reduce in addition to sugar and caffeine. Can you specify whole foods?
Absolutely. So when I talk about whole foods, I'm going to be talking about if we're talking about things that aren't processed. So fruits, vegetables, things that we go into the produce aisle, we're just gonna pick those up. we're going to be talking about, when we talk about grains, like our whole grains, 100% whole wheat, 100% whole grain. And this is not going to be when we're talking about reaching for snacks. Okay. And I'm guilty of this because I really like my nacho cheese Doritos. They are some of my favorites. But like, and I get it. I have kids, so granola bars are something that we have in our house, and those, I wouldn't consider those whole foods either. There's lots of sugar in them. But as much as we can do is those things that would produce almost naturally in nature, that's going to be some of the best thing. Beef jerky, something like that. So,
and to clarify, for the person that asked the question, we were talking about increasing whole foods, not reducing whole foods, right, Ethan? So like reducing sugar,
yes,
but increasing whole foods in the diet. Yep.
Absolutely. And I almost misread that question. So yes, we want to increase those whole foods and reduce the sugar and the caffeine. Okay.
All right, well, that looks like all the questions that came in.
I will stay on for, let's hold on for just another half minute, just make sure nothing else comes in. You do have my email address, so if you have any additional questions, please feel free to reach out. I'd be happy to help or direct any way that I can.
And everyone that attended today, they will get an email from me tomorrow, so check your email inbox for that. There will be a short survey after as well, so please give your honest feedback. We love hearing back from all of our participants and want to continue to improve and just provide useful and pertinent information. So keep an eye out for that as well. Looks like
All right, everyone have a good night. So thank you for joining us.
Good night, everyone. Thank you.